Okay. Hi, Carla. Good evening.
Hello.
Hi, Carla. How are you?
I'm okay. Thank you. How are you?
Very good. Thank you, Carla, for your time. And as we know, we are going to discuss your condition, your treatment experience with Veritan Neuro in Thailand. And so basically, we wanted to share your experience and hopefully discuss what options are available for someone like yourself suffering from spinal cord injury. So I will start introducing myself. Thank you everyone for joining. I'm actually a medical doctor and part of the medical team at Veritan Neuro, and I am partly responsible for a medical evaluation and treatment recommendations. I'm also coordinate various components of medical treatments for our spinal cord and non-spinal cord injury patients. So I have Carla, who is one of our patients who were recently treated in Thailand with epidural spinal cord stimulation and the stem cell treatment. Today we wanted to discuss her medical condition, her treatment experience, and make her available to answer any questions some of you may have. So I will maybe Carla, if you don't mind, I can briefly introduce your medical condition. You are suffering from cervical spinal cord injury at C6, C7 since 2012, I believe, and 2002. Yeah, 2002, almost 20 years, and you recently traveled, I believe, end of last year for epidural spinal cord stimulation treatment for your spinal cord injury. And you had incomplete quadriplegia and complete loss of motor function in your lower limbs, which was termed as ASIA-C. But it was considering your sensory function, which returned after your injury. But overall, it was a complete loss of motor function below the level of in the lower limbs. And I also remember your MRI scan findings, which confirmed chronic spinal cord injury, lot of myelomalacia, scar tissue formation over the spinal cord, which is a classical feature of chronic spinal cord injury. And do you mind maybe telling us a little bit more about yourself, Carla, and your maybe an overview of the treatment you received?
Okay. Well, like you said, I was injured in 2002, C6, C7. It was a car accident. Since then, I've done a lot of the physiotherapy. I don't know, sorry, I don't know much to tell about myself. I've been injured for close to 20 years. So sorry, doctor, I just don't know what much to say exactly. Do you want me to discuss my history until Thailand or then Thailand, I guess?
Yeah, maybe I think we can start. Let's do step by step. Let's start with your maybe the trauma, if you don't mind sharing what happened exactly. What was the nature of the injury?
I'm sorry. What happened?
What happened exactly? How did you get the injury? What was the unfortunate incident?
I was walking down the street, I guess, and I was hit by a drunk driver.
Okay, that's very unfortunate. And Carla, so since your injury was in 2002, so what kind of changes did you see before you actually came for the treatment? So what kind of recovery did you see in terms of your motor and sensory functions in the past 18 years?
Most of my recovery was more sensory, so it wasn't it wasn't the way it is now, but it was a little bit like I could feel if someone touches my leg, my feet, my toes, but it's different because I couldn't, if you took it's almost like I couldn't feel pain. I could just feel if you touch, or if you, I don't know, scratched my skin felt numb. So it was different. It wasn't 100% sensation, just mostly my sensation returned a little bit. And as for motor function, I don't know exactly, because I'm not really good at knowing what muscles work what. I just know that I gained the ability to at least do some training with leg braces. So I know I had a bit of the core function, not completely good, but it was okay. And I think I had a bit of hip function, but a little bit, and a little bit of glute, yeah, function. That's all I know that I had. That was a recovery, yeah. Oh, and also my triceps. Sorry.
Uh-huh. And did you get any major procedure apart from physiotherapy prior to your treatment where you received epidural stimulation? So was this the first major procedure you received in terms of your injury?
A procedure or just in general? Because I could say that I did do an exercise recovery program in between 2007, no, 2007, 8, and 2011. It was actually because of that I became able to do the leg brace walk, and I gained a bit more function. The recovery program was similar to what you guys do, only instead of the stim being inside, it's outside. So they would do a functional electric stimulation. Is that it? I'm not that good at knowing all these terms. And so they would train to walk with electric stimulation, but on the outside, not the way it is with this one, but it took a lot of training, and I had to travel to Ohio to do that.
Okay. So I think I will stop here, and I will add a little bit more information about the treatment you received actually. So Carla received epidural spinal cord stimulation. It's one of our flagship treatments for spinal cord injury, where we implant a small neurostimulator in the lumbar spinal cord, which is actually responsible for walking and producing step-like movements. This is located at around T12 thoracolumbar junction, T12 L1 part of the spinal cord. And so after the stimulation, we give stimulation to the spinal cord, and then the spinal cord results in muscle contraction in the corresponding muscle groups. So this is the treatment she received. And apart from that, she also received a stem cell treatment, which we will talk in a little bit more detail later. And so Carla, so what was your initial experience? I mean, how did the surgery go? What did you feel during the surgery, or maybe during the post-operative recovery, initial recovery after the implantation?
Well, first, I want to say, like, when I arrived at the hospital and like I got there, everybody was really nice and welcoming. The rooms was really nice. And then I got opportunity to meet you and the surgeon and some of the medical staff. And you guys answered my questions. You guys explained to me a bit more what to expect. And before I even did anything, you guys had me go through some tests, like the MRI and stuff, just to make sure I'm able to get the surgery. And then I was able to talk with the surgeon, who was very nice, and he was very helpful in answering my questions too. And then I had the surgery almost like, I think 24 hours after I arrived. I think it was roughly that. I don't remember much, obviously, because I was asleep, but I remember waking up, and it was just I think you guys had me rest for a bit, and then you guys I met the therapist, and they tried to see if the stim that works. And the initial, for me, it's different because I have sensation, so that's why it's hard for me to, I don't know how to explain this, because for me, it's because I felt the electricity, so it was surprising, I guess, just to see the legs kind of do its little movements. And also the feeling was surprising, because I didn't expect to feel the stim the way I did. Yeah, but it was it was an interesting when it started. I was already I was, I guess, impressed and looking forward to doing the treatment. So it was interesting at first and a little bit nervous because I didn't know I knew what to expect, but you don't know when you're not, when someone's telling you, it's different than when you actually go through it. So, but luckily I had very, very good therapists and you and everybody who was very, very nice and very patient with me.
Thank you, Carla. So for those who are wondering what does the surgery look like, it's basically a minimally invasive surgery called laminectomy. It's a removal of a small component from the lower back to insert the electrodes into the spinal canal, and then connect the electrodes with implantable pulse generator (IPG) into the posterior lateral abdominal wall just under the skin, which is the actual stimulator generating the electrical currents. The recovery takes normally 24 to 48 hours. The initial recovery, if there are no complications, we can start with the process which is called mapping. So I think, Carla, I would like to maybe ask again for your experience in terms of mapping. Maybe you can share the attendees, what does it look like, the mapping process, which is, I think, the most important part after the implantation.
Well, the mapping, first it starts off in bed just to, oh, sorry, I have electric bells. Give me a second.
It's okay.
Okay, that's better. Okay. The mapping, oh my God, you know what? I'm so sorry. I'm trying to remember again, like what it was like. Just bear with me. Sorry. No, I do remember that you guys, I remember you guys had me turn it on and then, I'm sorry, Dr. Sir, just trying to remember this. I'm so sorry. I really, it's not that I don't remember, just that.
It's okay, Carla.
All of it's mixed up together. I just remember that they came in, they had a little tablet, and then they would, the therapist would see what functions with the stim, I guess. And then I would have to focus on trying to see what I can do. I can't describe the mapping. I can't really describe it. Holy geez, I'm so sorry. I'm not prepared for that. I'm sorry.
Let me elaborate, Carla. So mapping is basically the process is kind of discovery process where we discover which muscle groups are responding to which electrical currents. So there are 4 major muscle groups in our anterior posterior lower limbs, and at least 20 small and bigger muscles which are required to come together, fire together for patients to walk. So the mapping is basically the process where we stimulate different muscle groups at specific electrical currents to get optimal muscle contraction. And once we get those muscle contractions, we train patients how to learn those contractions and control those movements. Carla, I think maybe people would also like to ask about the stem cell treatment you received, which was, I believe, in the 2nd week of your hospital stay. So what does it involve? Maybe you can share a little bit more.
The stem cell treatment, I know you guys do, I think 2 or 3 injections. I think 1 is on the arm and 2 is in the lower spinal cord. Right. I'm not gonna lie. I'm not gonna lie. It was a bit painful the first time, but then when I told you guys gave me something to help the pain. But it was, honestly, it wasn't really that bad. Yes, the pain was a bit much at first, but then they just, like I said, the thing about it is because the doctors, again, very, very nice. They're, again, patients. So they'll sit you on the side. They'll make sure you're okay, you're comfortable. The nurses will hold your hand just to make sure you're okay. They would give you something to help with the pain. And then you guys the doctor would put the injection, and then they would lay you down and you spend, I think, 6-7 hours lying on your back. And then, but it wasn't bad. It wasn't anything. The only thing I know is that you do feel a bit of burning sensation and tingling, and eventually a little bit more spasming. But the stem cell treatment part was not really anything. It was really more afterwards when you start to feel more spasms or like the little things that happen afterwards. But during the actual stem cell part, you're really just, it's not bad. It's easy to, yeah, sorry.
I think it was partly because of your preserved sensory function below the level of injury. So I think in terms of your recovery, so there was some initial recovery period where you were staying in the hospital under our care. So maybe can you share a little bit more about the changes you saw? I think this was probably the first time in almost 18 years that you were able to have certain functions back, which were never possible before, which you actually never had. So can you tell us a little bit more about your initial recovery period during the hospital? What were the first movements you saw coming back?
Oh God, I trying to remember everything. I think it surprised me with when we were doing the mapping and to see my ankles move, like my feet do like the movements. And then as we guys continued the mapping and with the stem cell treatments, I got to see like more my legs being able to, with me focusing on the stem, my knees being able to lift up, being able to straighten my legs. And this is something I haven't, like you're right, at the time I hadn't seen in like 18 years. So I was surprised. I know I shouldn't say I was surprised because, this is a good program, but because I didn't know what to expect, I came into there thinking that, well, I'll just come for the experience. If anything happens, happens. But I wasn't really expecting much because, you have to be a bit realistic that it was 18 years. And, everybody says after a certain time, you don't get anything back. So I was surprised how quick things started to happen. It was just first one leg, I think my right leg was stronger than the left leg. The left leg took time to start lifting the knee and going straight. And then eventually you guys had me try doing the bike. And it just to be able to do that was very, very, it was impressive. I wasn't expecting that. And then eventually you guys had me stand up and take some steps with the stem and be able to see my knees lift, like knee lift. And actually, because with the KFOs, it's very passive. It's just like you're just kind of pulling your leg and doing a bit of lift, but to actually feel your knee going up and going back down, like I wasn't expecting that. So that was it was incredible. And I just, because the problem is because the things that are then and things that are now, they're kind of in my head. Like I'm thinking of, because now it's been more progress and we could talk about that afterwards. But that's why right now my brain is more on what's happening now, which has been a lot of big changes. But I think my sensation got a bit more improved. It was really impressive. I know I'm using the word impressive a lot, but it really was impressive. I wasn't expecting that. Like I said, we
will get there. I think we're getting there towards your current recovery. But I would like to explain a little bit more what does the initial recovery period look like. So basically we start with very simple muscle movements. We go for the easiest muscles which are possible, the bigger actually hip flexors, quadricep muscles, those are the big muscles which are easier to find. And then we move towards smaller muscle groups, ankle dorsiflexion, so as we move forward towards the advanced mapping process, we keep combining those simple muscle, individual muscles into more complex movements. And ultimately the goal is to find the walking program or stepping program. Stepping program means a single program which is basically able to stimulate most of the muscles required for patients to walk. So this is normally we are able to find towards the end of the treatment in final weeks. In some cases where we are unable to find, we actually extend our stay anyway. So I think this is what we did, I believe, in your case, and you were discharged with the specific instructions to continue with those rehab programs. So were you able to follow all of the instructions, and how had you been doing so far since your discharge from the hospital, which is, I believe, almost 6 months ago?
Well, I have been able to follow a lot of the exercises you guys had me do over there, in the, especially like in the wheelchair with the knee lifting, the extension, and the as you said, dorsiflexion, and then the flexion, and doing core exercises. We incorporated more exercises into my program because of gains that I was getting. And before I continued, the reason why I knew about my gains is because my sensory increased. That was one of the main things that came really, really strong. So my ability to feel the stim is even more than before. What else? So no, I'm able to follow the program. I do the bike program. I do the stepping program. I have, what do they call, like the walking frame for that. I have a treadmill for that. I go to physiotherapy, but mainly my exercise is here with my personal trainer, my kinesiologist, and my dad. So most of my therapy is here, and we do a lot of the stepping program. A lot of the stepping program is actually outside. So I'm walking outside right now and doing the exercises there. Yeah, we've been able to follow the program and do more than just the program, just because, like I said, there has been more things, like more improvements. So we're trying to work with those improvements and combine them with the program you guys gave to me. So I think it's been actually really easy to follow the program in general. I think it's been easy. Yeah.
Okay. So we always advocate patients to continue rehabilitation programs. So I believe this is what you had been doing. So could you please tell us a little bit more about your current recovery? I think it's been 6 months since the initial treatment. So I think this is a good time period for us to basically catch up with your recovery so far. So maybe you can elaborate. Let's start with your maybe walking, Carla, stepping. What can you do? What are still some of the limitations you're facing?
Well, I can, well, the treadmill is is a hard thing to do. So I'll talk about that one last. I can, on the walking frame, I guess, with the little harness, I can, with the program, I could walk, I guess, take steps. See, that's complicated. I can take steps, I can walk forward, I could actually take steps backwards too. My limitation is that my left leg still goes out a bit. So we're trying to train my leg to be more straight and not go out so much. My right leg has started to go more in when walking. And I'm starting to learn how to walk like longer steps instead of it being really short steps. Now they want me to try doing longer steps. So when I'm on the treadmill, I need extra help, not extra, but I need a bit of help to make that extra push to make it longer. But if I'm walking on the ground or outside or in the garage, I can take the longer steps. Like I said, the main limitation is really keeping my leg in. I find that at the beginning of the walking, it's hard for me to lock my knees, but now, but when I continue after a few minutes, well, let's say, I don't know how, a few minutes, my knee starts to be able to lock when I'm doing my walking. So that's been an improvement. The only limitation there is I spasm more. So I have to like stop and really relax to stop the spasming. So I've had a lot of improvements with the walking, and then the bike, I can push the bike, but I need a bit of assistance with the last little bit, but overall I'm able to push and kind of like, it's hard to me to do, like, I can't describe that, do a full circle, if you will. And right now I'm learning how to do backwards for the hamstring, and I'm doing a bit better, but it's very hard because it requires a lot of that muscle. So it's a little bit harder to do. My core is improved. I'm able to do a bit more of the bridge by myself. So when they help me lift up, I can hold for a little bit by myself for maybe only a few seconds, and then I have to let go. So that's been an improvement. My standing balance is better. My ability to lock my knees for long periods of times are better too. Yeah.
Any change in your cardiovascular function or your other autonomic functions?
I'm confused. I sweat. I don't know. I sweat below my injury, I guess. No, actually, that's been surprising for me because when that's kind of embarrassing to admit too. But I do sweat on my feet now and my legs, and I sweat like if it's really hot and I'm in the wheelchair and I'm sitting and I get off the seat, I do now sweat. So, which is good because with my injury, we tend to sweat above the level of our injuries. So we sweat a lot like this. So it's good that now I'm able to sweat more the whole body, not just like that where it would be harder. Oh geez, I don't know what else to say. I'm sorry, I'm not good at knowing what autonomic function is.
Mhm.
Sorry.
Okay, cardiovascular function basically are, temperature, body, the blood pressure regulation.
Actually, yeah, my blood pressure has actually gone better. Before I used to, with the stim, I used to go up a lot, like go from really low to really high. Now, because we record the blood pressure and it's been very stable, like it stays almost the same from the beginning of the treatment to the end of the therapy, the end of the therapy. It's usually doesn't fluctuate too much. It stays the same. And we've been monitoring my heart rate while doing the treadmill. And my kinesiologist says that she likes that my heart rate's able to recover fast. So like if it goes up to 110, it can recover back down below 100 fast. It doesn't take time. And she said that's what's really good because that's what you want. The only thing is because of some muscle return and because of my sensation, I actually could feel my muscle pain, which is a new thing. And the downside of that is that when I'm doing the treadmill, it's after about less than a minute, I'm feeling the muscle like burning pain. And I try to keep going and I try to push. So yeah, that's been one of the new things. So it's a good recovery, but it's also a limitation because it makes me want to stop because it is a lot of pain in my quads, my hamstrings, my calves. It's how do you say, it's like a catch-22. It's good because it's recovery, but you just don't want to feel pain. So we're trying to figure out ways to like help me. So that's why increasing my potassium, magnesium, and other things to help with that. And that's why we're working a lot on the little muscles like the calves and the quads and the hamstrings, because these are muscles that I'm starting to feel. And they know because when they ask me questions, I would say I could feel here more, there more, and a point. And then we would focus on trying to find another training for that specific muscle group to make it stronger. So that's why we incorporated a lot of the muscle exercises, the strengthening it.
I think many people would also like to know, did you see any change in your bladder and bowel function?
That's a tough question to ask me. The only reason why is because that I had sensation. So I've always been able to feel when I have to pee. So I just, when I have to pee, I pee. Like, I don't know. I'm sorry to say that on camera, but yes, I've always had that sensation. They said that this is awkward to say this on Facebook. They say at 300 cc's, that's normal. And they found out years ago that at 300 cc's, I could feel the urge to go to the bathroom. That's why. And I think I've been able to start holding it in because when I was, especially in Thailand, I remember when I had to pee while doing the walking, I would tell a kid that, the therapist, that I would wait a bit and I would wait 20 minutes just to see if I could hold it in. And yeah, so I can hold it in as long as it's not too much, I guess. But yeah, that's kind of different because I've been able to feel my bowel's the same thing. I've always been able to feel if I have to go, I have to go. But in terms of actual motor, like be able to go to the bathroom, no, I require catheters and stuff.
Okay. Thank you, Carla. And I think I also wanted to add about your sensory function, the burning sensation and spasms you're suffering from. Actually, more increased spasms. I think, as we always discuss, this is not necessarily a bad sign. It's actually a sign of indication of recovery, potential recovery towards incomplete injury. So spasticity is the sign of recovery of those descending motor pathways, which descend from the brain towards through the spinal cord. So if there are more pathways, more muscle contractions, more spasticity. Same goes for sensory function. So before it becomes normal sensation, it maybe sometimes it goes through a small period of like neuropathic pain, burning sensation, tingling sensation. So hopefully we will continue to recover towards a better sensory function and better motor function. One of the important things, Carla, in your case, which is quite remarkable, is you are able to perform some of the functions which were initially possible with the help of the stimulator. So now you are able to actually have certain functions back, which indicates that maybe there is permanent recovery taking place in your spinal cord. So which happens after a few years in most of the patients, but in your case, it is happening actually quite fast. So would you like to tell us a little bit more about your functions, which you are able to do even when the stimulator is turned off?
Okay, well, this is what you kind of don't know yet because I've been waiting to tell you this. So I'm very excited about this. So as you know, I can now, sorry, my French is in my head right now too. I can kick without the stem. Before we needed the stem to help me, for me to kick. And I remember when I told you about this, I said I would have to do certain movements, kind of similar to what I did with the stem to get the kick. And then I would have to focus on tensing up the muscle and then doing the kick. Well, the latest has been now I don't actually have to do that so much, especially the right side. And it's the same thing with another movement that I don't use the stem for. Both movements, I actually have to focus on my calf muscles. And then what I do is I do what you guys call a flexion. So my heel goes up, my toes go down, and I focus on that. And then I can actually do the kick now because I'm focusing on my lower, like my feet, my ankle, my calves. So my physio and everybody said that's actually good because it's not so much then how big I do the movement. It's good that I could do the kick and the push, but I'll talk about that after. It's the fact that for me to do that, I have to focus on doing a flexion. That's what you guys call it, the lifting the heel and pushing with the foot. Yeah. So that's been one of the good improvements is that I could feel my calves, like I could feel myself squeeze my calves. And when my therapists they could actually feel the contraction. And my therapist said that she knew when I'm going to move my leg because my toes curl first. That's because I'm trying to focus. So my toes will curl and then will go. And then with the right side, I'm also able to control when I do the push, I can actually control the knee from locking. So so sorry, so I was going to tell you there is now two. Now I can do the push, like extending my leg, and I can do a kick without the stem. And what I do is, like I said, I focus on specific muscles like my calves and my feet and all that to make it happen. And the other thing lately is we tried this twice, so I can't say for sure right now, but when I'm standing up and I'm lifting my knee, because we do knee lift exercises, I no longer use the program for the knee lifting. I'll use the spasm program to stop the spasming, but I'm able to do that without needing the program anymore. So that's been the latest thing that's been happening. So it's been good.
It's quite remarkable because so I believe what is happening is there is a lot of neuroplasticity regeneration going on in your spinal cord as a result of direct stimulation. Also, I think stem cell treatment, I believe, had contributed to a good extent in your recovery. And also, I just want to tell you and other patients, if this continues. If you continue with your exercise, the use of stimulator over a period of next few years, we should expect, I would say, significantly better recovery. So I think this is a good start. If this is happening in 6 months post-treatment, I think that's quite remarkable recovery so far. So we are having actually some questions from Anne. The surgery is in Thailand. The treatment cost depends on the final treatment plan, depending upon the location of injury, what kind of treatment we are offering. So we can share more information later on, but it's around $97,000, including the stem cell treatment, which involves intravenous and intrathecal injections and 35 days of hospital stay for all of the surgery, post-operative recovery, programming, and all the rehabilitation. Yeah, so someone will be in contact. Please share your email. Anyone who is interested in learning more about their condition or going through the medical evaluation process. Yeah, the medical evaluation is quite important because normally, unfortunately, not everyone is a candidate. Many of the patients suffering from spinal cord injury would qualify for one of the available treatment options. We actually have other programs also, not only epidural stimulation, depending upon the nature of the injury. We also have stem cell programs, which is we call LemiSpine, which is direct intraspinal cord injection of stem cells at a specific locations in the spinal cord. And I think we don't have any more questions, Carla. So do you have anything to say, maybe to wrap up our discussion? Any message for spinal cord injury patients out there who are listening to you?
Well, I do think this is a very good program. I think that it's definitely worth going. It's worth giving it a try. I'm not going to pretend there's never any guarantees, but so far I've felt that I've had a lot of positive recovery, I guess that's the word, I don't know. It's enabled me to do things I couldn't do before, enabled me to do exercises I didn't think I could ever do. With or without the stim, it's just the fact that I'm able to do a lot of these exercises like the bike and going to the pool and all that stuff. It's something that I would never think I'd be able to do. So I think it's worth trying out.
Okay. Oh, we just got one question from a potential, I believe, client, a patient. They say that what are the side effects from the treatment? I mean, after a few years. So I think normally there are potential side effects. The most common, are not the most common, but the severe one is a small risk of infection. But also some patients, they see some fluctuations in their the blood pressure levels. They also see increased level of muscle tone or spasticity. And also from stem cells, some patients, they suffer from in headache, sometimes fever, sometimes back pain, depending upon their sensory function. So actually now we're having more questions, Carla. So the question is, do we do stem cell treat? Do we have results with those stem cells? Some of the patients, they do actually get epidural stimulation only, not the stem cell treatment. We see improvements in mostly in the motor area, because epidural stimulation is a specific treatment for the motor function. It does not directly do too much for the sensory function, but for if we want to target specifically the motor function, then epidural stimulation can be done without stem cells. So Victoria is asking if the treatment is beneficial for Asia A, C5 Asia A. Yes, Victoria, it depends on the upper body function. So if there is significant loss of upper body function, for example, if there is no very limited bicep tricep function, which and also no finger function, no wrist function, then we do have actually the same treatment for the upper body function. We call cervical spinal cord stimulation, where we implant the stimulator at the cervical level. In Carla's case, I think as we can see, she has C6, C7 incomplete, so she does have reasonable upper body function. So that's why in her case, it was for the lower body function, the treatment. But in case there is significant loss of upper body function, we do start with the cervical stimulator and then we move towards the lower body stimulator. And this can also restore the hand function, finger function, and improve the sitting balance. And the patients are able to regain basic functions back, for example, ability to drink, move from a power wheelchair to a manual wheelchair where they are able to push the wheelchair on their own. And many of the patients may be able to actually transfer from the bed to wheelchair on their own or with limited assistance. So someone is asking, can you stand and walk outside the frame? I mean, without any kind of support?
I wouldn't try that. I mean, no.
Yeah, and this is actually not what we expect from the patients because it would take, actually, this means that we are expecting a complete recovery. So which is unfortunately, unlikely. So we encourage patients to stay realistic. And I think what we expect is the ability to walk with support, some kind of assistance to maintain balance and coordination. So Anne is asking, T12L1 spinal cord injury. Normally, epidural stimulation does not work for lower thoracic injuries or the lumbar spinal cord injuries, T12L1. But we do have another treatment we call again Lamispine, which is the stem cell based treatment where we implant stem cells inside the spinal cord after a small neurosurgery. So this treatment can be performed in patients with T12 injuries. Some of the patients with T12 injuries, they have a condition which is called low-lying spinal cord. So actually on the MRI scan, some of the patients based on the MRI scan may actually qualify for epidural stimulation. So again, I think we will have to look at the individual case to see the location of the conus and to propose a suitable treatment option. Okay, Victoria is asking the cause for the spinal cord stimulation is the same, which we explained with stem cell, 35 days of stay and all the therapies, all the surgery. It's $97,000 US. Okay, I think that's it, Carla. If any of the patients may have any questions, I think they can reach to us directly and we will be happy to assist with individual medical assessments. Thank you very much, Carla, for your time, and have a good night.
Okay, you have a good day.
Thank you very much. Bye.
Bye.